Good morning. Today I am going to do an ultrasound-guided SVF and PRP injection into the left knee of this patient. She is a 73-year-old lady. She has undergone a right total knee replacement 1 year ago. She has undergone this right knee replacement in another hospital in Chennai, but she was not very happy with the experience. This is the general prevalent attitude of patients towards knee replacement. In this case, she said that the hospital staff punctured her vein several times and she was very traumatized by the whole experience of knee replacement. Then there was the painful process. Recovery was quite delayed and painful, and therefore this time, although she is 73 years old, she has opted for a SVF treatment. So I will be injecting the stromal vascular fraction or SVF under ultrasound guidance. So this is the ultrasound machine, but before we proceed with the actual procedure, I thought I should like to explain to you about the ultrasound machine and how it is to be used. So the ultrasound machine is a kind of a sonar device. It receives electricity and emits ultrasound waves through a crystal in this probe. This device is known as this part is known as the probe. Inside this there are many crystals called piezoelectrical crystals. When electricity is passed through them, they emit a sound frequency in the ultrasound range. So this is the ultrasound probe and this is the ultrasound monitor. So linear probe, its frequency can be adjusted by the knobs on this. So here we have the frequency. So this is the frequency adjuster here. So here you can see 9. This probe is ideal for musculoskeletal. So I have adjusted the frequency to 9 megahertz. Then the next parameter which I adjust is the focal points. So you can see on this machine here that there are 3 focal points, 1, 2 and 3. So I adjusted by this knob here. So these are the focal points, they are going deep, 3. I will reduce the numbers. So I have reduced it to 2. And there is only one focal number here. That is below the 2 centimeter mark. I control for gain over here. This is the gain. You can see here the gain. So the higher the gain, the brighter the image. As you saw that it goes brighter. Then I can adjust the focal position. So this is the focal position now. By turning this knob, we can increase or decrease the focal position. So you can see that moving here, this thing moving. Okay? Can you see that? Can you see that this moving?
Just a second.
The ultrasound probe has got several panels to a mobile phone camera. When you are using the mobile phone camera, you set the frames per second, resolution as 4K, focal length, everything you use, you set by pressing on the phone. Same thing you are doing here on this also. That is, you are increasing the resolution up to 4K as on this phone. Then focus we have just done here, and then resolution we adjusted by increasing the gain. So these are the parallels of the ultrasound probe, ultrasound machine and the mobile camera cell phone. Now I am going to scan the left knee and show you the findings. This is the left knee. You can see the dense white line at the bottom here. That is the femur. And as I go down into the knee, you can see the sulcus, the V shape. Now the knee is appearing like a V shape, and that is the intercondylar sulcus. And I will be injecting into the knee from this side. You can see the movement over here. This is the bone. This is the bone, and this is the medial side. That is the area of the effusion, and the needle will be coming from here. The ultrasound anatomy of the knee joint, starting with the front of the knee joint. As you can see, I have placed the probe over the front of the knee, and the probe is placed partly on the thigh and partly over the bone. And you can see the images here. So this is the soft tissue, and this is the quadriceps tendon. It goes to this hard bone here, the white one, that is the patella, this is the patella. And you follow the patella down. This area this is the patellar tendon from below the patella, and it goes to the bone here, which is the tibia tuberosa. So this is the front of the knee joint. And now I am coming to the inner side of the knee joint. You can see that the probe is on the inner side of the knee joint. This dense bone here is the femur bone or the thigh bone, and this is the femur bone. This is the meniscus. This is the meniscus. You can see that the meniscus has actually moved out of position, and this is the tibia bone. This is the meniscal. You can see some tearing in the middle meniscus. There is a black area there. This is the tibia bone. This triangular area is the meniscus. I will be using this landmark to inject into the tibia and the femora. So this needle is over the joint line. This is the PRS solution. Now you are able to see the outline of the knee joint. The technique to hold the ultrasound probe. I am holding the ultrasound probe with my thumb and index finger, and the other 3 fingers are resting on the skin. So the probe is steady now, and now I am going to introduce the needle. You can see the needle there. It is into the knee joint. Procedure is over. It's a very painless procedure, as you have seen. We will talk to her later and learn about her experience. Thanks for watching. If you found this video useful, share it with your friends. Like it. Leave your comments in the comment section below. I'll see you in the next video. Cheers.